Hi friends, welcome back to my YouTube channel Pratibha's Nature Delight. Today I am going to discuss the topic of scrotum. I will explain in details of scrotum. So let's get started. So starting with the topic of scrotum. Scrotum is a cutaneous bag which is present in the perineum. In the surface of the scrotum, wrinkles are present, which is because of subcutaneous muscle which is known as the dartos muscle. It is an involuntary muscle because it is supplied by sympathetic system. Sparsely hairs are present. Large number of sebaceous glands are present here. So sebaceous cyst most commonly occurs in scrotum. Next, there is a raphe present in the scrotum. It shows the fusion of embryological right and the left half. Here I have drawn a diagram. Here you can see this is the right and the left side. This is the labioscrotal swelling embryo. In the embryo, it occurs in this shape and later it fuses. Here you can see in this green I have drawn. When it fuses, this midline, it becomes the raphe. Next, coming to the layers of scrotum. The layers of scrotum is contributed by the layers of spermatic cord. Here you can see, friends, this is the spermatic cord, this is the scrotum, and this is the layer of the spermatic cord. Here you can see the layer of the spermatic cord is also covering the scrotum part. Here you can see here, friends, I have drawn this diagram. This is the scrotum. This line is the skin. Here you can see I have drawn this dotted line and this layer. So this dotted line is the outer layer, that is the fascia campus. This is the fatty layer, and this layer is the inner layer, that is the scarpus fascia. It is membranous layer. These both layers are continuation of the anterior abdominal wall. Here again in the scrotum you can see here this dotted line. This is the dartos muscle. It is a subcutaneous fatty layer. It causes wrinkling of the scrotum. Next, you can see here, friends, this is this green line I have drawn here. This is the collis fascia. Collis fascia is the continuation of membranous layer of anterior abdominal wall. The next, coming to here, you can see I have drawn another line. This is the blue one. It is the external spermatic fascia. Again the next line, here you can see here this black dotted line. This is the muscle layer. It is the cremasteric muscle layer or cremasteric fascia. And again the next layer, this is the red line. This one is the internal spermatic fascia. So it's very important to know what are the layers of the scrotum. First, here we can see it is the skin. Then next, coming to the campus fascia, which is the fatty layer. Then comes the scarpus fascia, that is the membranous layer. Then comes the dartos muscle. Then next comes the external spermatic fascia. Next, cremasteric muscle layer or the cremasteric fascia. Then next comes the internal spermatic fascia. And after that, here you can see this layer. This is the tunica vaginalis. This green part with this one is the testis. So this completes my diagram. So friends, I will explain this is collis fascia also. The layers of the spermatic cord also becomes the layers of the testis and also the scrotum. Now coming to the layers of the testis. Testis is outer layer and inner layer. Outer layer is contributed by anterior abdominal wall continuation and inner layer is from the outer layer of the spermatic cord. Here you can see, friends, this one is the processus vaginalis. The testis is normally it becomes a ballooning and invaginated. The testis is invaginated from behind. So here you can see it pushes in this way. So after invaginating from behind, it becomes this shape. This is the tunica vaginalis, this is the parietal layer, and this is the visceral layer. Testis develops in posterior abdominal wall in lumbar region and it migrates downward into the scrotum. In the scrotum, the temperature is low, it is cool, which is very important for the production of spermatozoa. Testes have nerve supply from its origin itself in the posterior abdominal wall. It's very important, friends, to know the nerve supply of scrotum and the nerve supply of testis. Here I said that testis have nerve supply from its origin, that is in the posterior abdominal wall, and the nerve supply of the scrotum, the dartos muscle, is supplied by the sympathetic system. The skin has cutaneous supply. Anterior is L1 root, genital branch of genitofemoral nerve, and posterior is the pudendal nerve, it is in perineum, and fibers are from S3, the scrotal branch of the pudendal nerve plus branch of the posterior cutaneous nerve of thigh. So here I will say that L1 root and S3 is very important in the supply, cutaneous supply of skin of scrotum. Next, coming to the cremasteric reflex. Cremasteric reflex, in which if the inner part of the thigh is stimulated, the same side of the testis, it contracts upward, like it goes upwards, contracts upwards. So the reason behind is, like here you can see, this is the femoral branch of the genitofemoral nerve, takes this reflex upward, and it downwards, it is the genital branch of the genitofemoral nerve. These two nerves are very important in causing this cremasteric reflex, which causes the contraction of the cremasteric muscle. It causes cremasteric reflex, that is the elevation of the testis sulcus. So what is the importance of cremasteric reflex? So when we do this test only to know if there is any undescended testis. If there is any absence of cremasteric reflex, we get to know that there is undescended testis, in scrotum testis is absent, or there is cryptorchidism. So here I complete my discussion today of details of scrotum. Hope you liked my video, friends. Meet you with a new topic in my next video. Like, share and subscribe to my channel, friends. Bye.